minutes, ma'am.
Yeah, okay, sure.
Good afternoon, everyone. iTech India welcomes all the participants for today's National Distance Learning Seminar Series. Today's topic is mental health during COVID-19, and the speaker is Ms. Shivranjani Kulkarni. Ms. Shivranjani Kulkarni is currently working as Senior Manager Operations in the School of Vocational Education, TISS, Mumbai. She is a professional in the field of development sector and counseling. She has more than 2 decades of experience in handling large-scale projects, especially in HIV/AIDS and counseling. She has worked with Maharashtra State AIDS Control Society for 7 years and is working with Tata Institute for the last 10 years. Ms. Kulkarni has contributed to the development of various capacity building strategies and manuals for master trainers, supportive supervisors, and counselors while working on Project Saksham of TISS, which was founded by Global Fund Round 7. Kindly note this session will be for 1.5 hours, so kindly bear with us. We welcome you, ma'am, for today's session and request you to start the session.
Thank you, Shweta, for the introduction. So as you all know, COVID pandemic, it has started since February 2020, and the lockdown and basically the fear about it, the anxiety about it, all those things started from March 2020, and till date it is going on. And really it is taking a big toll on everyone's mental health. And after all, the healthcare workers who are the frontline workers who are fighting against this COVID-19 epidemic, it is taking a toll on their mental health as well as physical health and overall well-being. So I'm sure you must have heard such sessions during this 1.5 years time, but still, like, each and every session is important for you, because in each and every session, you must be getting some tips to deal with your own stress. So I think let us start discussing the various points about managing our own stress as a healthcare professional. Yeah, just a minute. Just a minute, bear with me. There is some technical issue. I'll open the PPT again, and once again, I'll share it.
Screen is visible, ma'am.
Yeah. Yeah, I'm so sorry for this disturbance. Yes. So first we'll look at the content, what we are going to cover in this session. We are going to list the stressors and psychological responses to it experienced by healthcare workers working in the National AIDS Control Program during COVID-19 pandemic. So what I have done here, like, I have listed some stressors which are being experienced by our health workers in the National AIDS Control Program. I have talked with a few persons, and also like in Tata Institute, we have some projects which are going on in this field. And after reviewing, I have listed these stressors. So basically, we can look at these tips for managing our mental health in the context of NACP. We are also going to discuss burnout and the reasons to take care of the burnout. Why emotions matter in healthcare? Because in healthcare, usually the focus is on physical health, but we need to discuss the emotions as well, the emotional health as well. So we are looking into the details of these things. We are also going to talk about various strategies to deal with emotional issues, and also how the healthcare workers can help their patients to deal with their emotional and psychological issues that we are going to talk about. This quote I found somewhere on the net, and therefore I thought it is worth sharing with you. This is WHO's message. It is very important message that stress and the feelings associated with it are by no means a reflection that you cannot do your job or that you are weak. Because basically the work is so much, the stress is so much that sometimes one can feel that I'm not capable of handling these many responsibilities or carry this much of workload. So in that context, this message is very important. Now, the stressors, which stressors are being experienced by the healthcare workers in NACP. First is obviously high workload, because you all are handling your routine work under the National AIDS Control Program. In addition to that, there is responsibilities for COVID-19 pandemic, therefore stretch working hours, no breaks in work, sometimes even no break on Sunday, impact on achieving targets, restrictions on traveling due to lockdown, because we can achieve our targets if our clients are reaching to our centers. But there are a lot of restrictions imposed due to the lockdown, and patients or clients, they cannot travel to us, to our centers. And obviously, a less number of footfall is there in our hospitals. Many hospitals have been converted as COVID hospitals, which is also decreased, which also resulted in decreased number of patients coming to OPD. The follow-up of ART patient also is getting affected due to this. Also, since the intervention is getting affected, there is high risk of increasing HIV positivity rate. There is scarcity of human resources, because we need a lot of human resources to deal with this epidemic. But obviously the resources, human resources, are limited. In the initial period, there was scarcity of masks, sanitizer, and right now there is shortage of vaccines. So all these things are creating, the shortage of resources is creating a lot of stress among the healthcare workers. Also, there is a high risk of infection to self and family members. Many health workers and their family members have got infected with COVID-19. Some have even lost their loved ones. They are also facing stigma and discrimination, even in their own society, in own family, which is quite painful. And also there is pandemic of anxiety and stress. Why I have mentioned this pandemic of anxiety and stress? Because as we go further, we will discuss that the emotions are contagious. As we say, COVID and other infections are contagious. The same thing is emotions also are contagious. For example, if you are sitting in a room with a few persons, the dominant emotion will be experienced by other persons as well. And we always see this in the time of pandemic or in disasters. For example, during any disaster, if some person or a group of person got afraid or scared or anxious, like that anxiety is created so much, and everyone is got affected with the anxiety. And obviously the needful measures which should be taken, those measures are not taken in such situation. So it is said that even today there is pandemic of anxiety in this COVID-19 situation. And also obviously our media also is pouring fuel into it. So we need to even deal with this pandemic. Now, what is the psychological impact? Obviously, as we said, stress and burnout, the physical health and psychological well-being is getting affected. The family life of our health workers is getting affected, because hardly very less time they can give to the family members. Also, if they come from work, they feel scared that because of me, my family members should not get infected. And therefore, one has to maintain distance. Even girls with small children, girls and boys, we can say small children, they cannot even hug their child. So like all such situations are arising in the family, and the family life is getting disturbed. Then they're feeling being trapped, because they cannot leave the work. They're not allowed to leave the work. Taking leave is not possible. And also it is difficult to do the day-to-day work, carry out the responsibility. There is a lot of burden they experience. And the psychological symptoms which are come obviously due to this. They are anger, anxiety, depressed feelings, sleep disturbance, and grief due to the loss of loved ones or due to the loss of our own health. And there are feelings of hopelessness, helplessness, and worthlessness. So these are the psychological impact our healthcare care workers are experiencing. Now, there is a phenomenon burnout. I'm sure you all have heard about it. Burnout is the result from chronic workplace stress. It is especially observed in service providers. For example, teachers, nurses, doctors, means all healthcare workers, this is experienced. The symptoms are feeling of exhaustion, increased mental distance from work, means you are doing the work, but you are not really speaking into it. You are not psychologically involved in your work. Then feeling of negativism, loss of motivation. You don't feel like to go to work in the morning. Then feeling trapped and defeated. You feel that you're just trapped here. You cannot go out. And there is a lot of increased dissatisfaction. Dissatisfaction not only about the job or work, but overall life dissatisfaction. So these are the symptoms of burnout. ICD-11, the International Classification of Diseases, they also have mentioned burnout as it is not a medical condition, but it is a condition which should be paid attention to. And what they have mentioned, this is experienced on 3 dimensions: feeling of energy depletion of exhaustion, increased mental distance from one's job, feeling negativism or cynicism, and reduced professional efficacy. Now, why to manage stress and burnout? A person's physical and psychological health and well-being gets affected due to stress. The healthcare workers are always serving to others, so self-care is equally important. The work, because of this stress, the work quality gets affected. And obviously in healthcare sector, even a small mistake may cause danger to the patients. So really speaking, we cannot afford to have such mistakes. The external factors creating stress are beyond one's control. So important, it is important to manage one's own stress and emotions. Because for example, the shortage of vaccines or other things, like for example, government is imposing lockdown, but still people are not following rules and they are falling sick, they are getting infected and getting admitted in hospital. The crowd is increasing over there. So all these factors are beyond our control. So what we can control, we can deal with our own stress and emotions. And therefore, we are discussing this point. Stress also is that stress is created by our own understanding of the situation. So if you learn to manage it, you will feel in control. For example, in the same situation, the stress experienced by various people will differ from person to person. For example, in your own hospital, one person might be very stressful, under a lot of stress, and in the same situation, another person might be very cheerful. So the understanding is different person to person. Now we are going to do one activity. So are you ready for this activity? Yeah, I'm sure you must be ready. The first thing to manage your own stress is the awareness of your own psychological stress state. If you are aware of your own psychological state, you will know what to monitor, how to manage, and what not to manage, and what is not possible. So all these things will happen if you know your own emotions and thoughts. So right now, just close your eyes and think, what is your predominant emotion right now? Name the emotion. That emotion can be any. It can be anger, it can be depressed feeling, or it can be happiness. You might be cheerful, glad, whatever. So name that emotion and mention whether it is pleasant emotion or unpleasant emotion. I'm sure you must have named that emotion right now. What are the other emotions which are there but not so predominant? Name these emotions as well, because sometimes simultaneously we experience more than one emotion. For example, if you are anxious or if you are depressed, at the same time, you might be feeling guilty about something. Same time, you might be glad about certain things which happened in the morning. So there is not a, I mean, at one time you, hello, am I audible?
Yes, ma'am.
Okay, because here I'm getting message about the internet connection got disconnected. Okay, I'm so sorry. Yeah. So at the same time, we are experiencing more than one emotion. So name all those emotions and also identify what is the predominant emotion. Now I have this diagram I'm showing you because usually we identify emotion as broad emotions like, as I said, anxiety, depression, anger, guilt, these broad emotions we identify. But there are a lot of emotions and there are various shades to those emotions. For example, sadness and depression, these are two different emotions. Fear and anxiety, these are two different emotions. Glad, happy, delight. Again, these are various shades of a similar category of emotions. So if we can correctly name the emotion, it will help us to manage it better. So therefore, in our counseling classes, we always ask participants to increase their vocabulary of emotions. Now, I'm sure you must have identified your predominant feeling or predominant emotion. Now, what is the intensity of that predominant emotion and other emotions as well, which are not predominant? So, for example, right now I'm anxious because I'm talking with you. So my emotion is anxiety and it is not very low. So it is not 1 and it is not 10. It is somewhere in between 3, 4 or 5 maybe. So like as we have this thermometer, we can say we can measure the temperature. So just imagine that we have a emometer or some meter to measure our emotion. What is the intensity? So identify the intensity of your key feelings. I'm sure this is quite doable and you must have done this. So on the basis of these two dimensions, one dimension is whether the feelings are pleasant or unpleasant, and another dimension is the intensity of emotion. We can have these 4 quadrangles. We can have these 4 squares in which we can be, we can divide our mental state or we can divide our psychological state. For example, if you have unpleasant feelings and their intensity is quite high, then you are in red zone. If you are feeling unpleasant and its intensity is low, then you are in orange zone. If your intensity of pleasant feelings is high, then you are in green zone. And if you are feeling pleasant, but the intensity is low, then you are in blue zone. If you are in blue zone, then no need to worry. If you are in green zone, then no need to worry. But if you are in red zone, and if you are continuously in the red zone, obviously, like our in our day-to-day life, we are experiencing a lot of feelings. But if we are consistently in the red zone, then definitely we need to pay attention to our mental health. And we need to like do certain strategies to be in the at least blue zone or green zone. If we are in the orange zone, definitely that is the feelings are unpleasant. But we need to monitor that, yes, the situation should not be out of control. I'll give you one example. For example, I'm continuously anxious and my intensity of anxiety is always 8, 9, 10. Definitely I'll be in high intensity and unpleasant feeling zone. So this means I need to do something about my anxiety. So I'm sure you must be clear about these 4 squares. And on the basis of this, we are going to do this activity, take a poll. So Shweta, can we like take the poll right now?
Yes, ma'am. Yes, ma'am.
Yeah.
Your participants are requested to kindly select the one that they may be feeling, the feeling that they may be feeling right now. Please select your options. Yeah, we have 120 plus participants, only 55 have selected.
Okay,
Yeah, we
we
can
can
end the
wait for a
poll.
few seconds and
Okay, sure,
we
ma'am.
can go ahead.
Sure, ma'am.
Yeah. Very
Yeah,
good. So here, yeah.
Yes, can we end the poll now?
Yes.
Yeah.
Yeah.
Here are the results, ma'am.
Okay. Very good. So 27 means 44% participants are in green zone, which is pleasant feeling and high anxiety. 38% are in blue zone. 6% are in red zone, and 8% are in orange zone. So I'm sure now you must be feeling pleasant or very positive because you are hearing this lecture, most of you, and you have taken out time for yourself. So it's a good sign. And regarding red or orange, I will advise that we need to take care of our own emotional issues. And maybe while we go ahead, the tips or the strategies or managing emotions we will discuss, that will be definitely helpful for you. Yeah. Thank you, Shweta. So please remember, if we are consistently in high intensity zone or red zone, then we need to do some intervention. But some or the other time in our life or in our day-to-day routine, we might wander in all these four squares. So there is nothing unusual if we are in red or in orange. Yeah, once in a while. Thank you. Just a minute. Yeah. Now, we have identified our own emotion, which is a strong emotion, and what is the intensity. We have talked about it, or we have thought about it. Now the next point is, what are my thoughts? Because behind these emotions, we have certain thoughts, and these thoughts give rise to those emotions. For example, I have given here some examples. Anxiety or tension is created when the person or the healthcare worker has reached to the ART center and it is very crowded. So the thought is, the ART center is so crowded. How am I going to manage so many clients? So obviously, this thought will give rise to anxiety or tension. Maybe the person feels such a silly mistake. How couldn't I notice it? This thought will give rise to the emotion of guilt. This person is always a problem. She never comes on time. So this thought will give rise to anger. So basically, my point is, emotions and thoughts are quite associated. And if we can identify this link, it will help us to note from where these emotions are coming from. Because when we talk about our own psychological state, that time we are talking about our emotions, or we are thinking about our emotions, and these emotions are coming from certain thinking pattern. So it is very important to identify the thoughts behind those feelings. So I request you to note down your thoughts. What are the thoughts behind these feelings? And one point to note is, do not judge yourself on the basis of these thoughts or emotions. Just observe, because it is quite natural to have these thoughts and emotions. And once you practice identifying your thoughts, identifying your emotions, managing them, definitely it is going to help you. Now we are going to talk about the strategies or tools to manage stress and burnout. Here is another quote. Burnout happens when you avoid being human for too long. Then I would like to complete the sentence here. Avoid being human for too long with yourself. Because in healthcare setting, you all care for others. You care for patients. You must be caring for your family members, to your loved ones. But important is that you should care for yourself as well. And therefore, self-care is the first strategy. Uh, Now, healthcare workers, as I said, they're always giving to others, and so they feel exhausted. I would like to give an example of a tree. For example, a tree is full of flowers or fruits, a very green green tree. Now, if you start taking fruits from the tree, if you start taking the leaves, branches, and if you are not caring for the tree, you are not giving any manure, water, light to the tree, obviously it will start it will be pale. It will start drying. But if you care for that tree, it will have more fruits. It will be a more beautiful tree. So the same is applicable to the healthcare workers as well. If you take care of yourself, you will be able to take care of others. And therefore, the all self-care aspects are very important. So the nutrition, I need not talk about nutrition over here because you all know the importance of it. So pay attention to the nutrition, exercise. We always give excuse of the time that I don't have time. But at least one can say there is one principle that when you say I don't have time, at least find out 5 minutes to do that particular activity. Instead of procrastinating that activity, at least find out 5 minutes time for that activity. And you will find that these 5 minutes also are quite meaningful. And once you start doing for 5 minutes, it will be easier for you to increase it to 10 to 15 minutes. And obviously, some exercise is always better than no exercise. And I'm sure in your such a busy routine as well, this much can be done. Then self-appreciation, because you appreciate others, You appreciate when patients make good progress. And so the self-appreciation is important. In our system, we always feel that my superiors or my boss or my clients, they should appreciate me. But we don't know. They might not appreciate. On the contrary, they might criticize. But you know what efforts you have put in. So appreciate yourself. Also, self-compassion. You are showing compassion to others, but show compassion to yourself. Trust yourself, your abilities. Find out what is good about my work, what is good about my overall situation. All these things look very simple, but I'm telling you again these things because when we are under stress, we are always looking at the negative things, or we are always looking at our own limitations. So it is the right time when we should remind ourselves of our positive things. Also, the positive things which are happening, the good things are happening around us. And somehow in our busy schedule, we miss to notice those things. They can be simple things, but say, for example, if you maintain a diary of these small things, you will find that the things were many. The things can be very simple, like a hot cup of tea, rains, hot water bath, or a good conversation throughout the day with any person. So all these are like positive reinforcements to us. And we should notice it in our mind. Every time, no need to write in the diary, but we should recognize, yes, this good thing has happened with me today. I talked with that person so nicely. Connect with loved ones whenever possible. Because in our busy work, we are always talking with our colleagues, with our team members, with our patients, or with other person who are connected with us professionally. And another set of persons is our family members. But apart from our colleagues and family members, find out people with whom you can connect and you can talk with them. You can discuss about various things with them. And this will also give you a lot of relief. Start every day thinking that it is my day. What can I do for myself? And do at least a small thing for yourself. Most of the time I have seen when I used to conduct training for these like healthcare professionals, that time, I means every day, means that used to be our routine. We used to conduct these trainings. And every time we used to listen to the complaints that the day is boring. Means they don't feel like to go to the work. So I feel that this work is not for, the day is not for that particular work. The day is your work, the day is your day. And you decide what I want to do of my day. And do at least a small thing for yourself. Yes, obviously, the work, the routine, all those things will be there. But besides that, apart from that, find out some time for yourself. Understand that your job is not equal to your life. It is just a part of your life. Also, another tip I would like to give is minimize news feeds and discouraging news. Restrict the use of social media. Do not succumb to unhealthy ways to reduce stress, that is gaming or use of alcohol. Also, if possible, try to sleep on time and get up on time. This will give you a routine and also it will manage stress. Tell yourself that this situation is not a permanent situation, because now in this epidemic situation also you must have experienced that last year there was a lot of fear and like everyone was getting prepared for patient load. In between, like the graph had come down, the number of patients were quite less. And again, in the month of April, May, June, again there was a peak. So even in epidemic situation, the situation is not same every day. So right now, due to epidemic, even if you are under stress right now, that is not going to be a permanent situation. Now, other tools to manage stress and burnout. This is self-care we talked about, but there are other strategies as well. In short form, we can say this as ruler. So what is ruler? So recognize your emotions, which we have done right now, the demonstration. Understand the causes and consequences of emotions. Because what are the consequences of my emotions? For example, if I am very angry And if I shouted at my team member, and if I do this again and again, my team member might leave the job. Again, the new team member will come. Again, I will have to train that team member. So maybe if your anger is, you cannot control the anger, these might be the consequences. So my point is that understand what are the causes of your emotions and what are the consequences of it. Also label the emotions accurately. While labeling, you will understand them better, because there are certain emotions which are positive, pleasant, unpleasant that we have seen. But even in negative emotions, because like really speaking, no emotion is a bad emotion, and all emotions have some purpose. For example, fear or anxiety. This emotion helps us to protect ourselves. uh, because if I'm not scared of this fire, I'll jump into the fire. But I'm scared of fire, and therefore I'm not jumping in the fire. So my fear is preventing me to doing harm to myself. So even the negative emotions have some functions, and we need to identify them properly. However, the negative emotions, like we can say healthy or unhealthy. For example, if you have too much of anxiety, you won't be able to perform. But if you have moderate anxiety, you might be able to do well. And if you have no anxiety or no concern, you will feel like not to work. You will not have the motivation. So take a typical example of examinations. The students appear for examination. If they are highly anxious, they might not perform well. If they are not at all bothered about the examination, they will not study. But if they are moderately anxious about it, they will study and perform better. So labeling emotions and identifying is important. Also express emotions appropriately and regulate emotions effectively. Now, expression of emotion, though I'm angry, how should I express my emotion? That I need to learn, because my anger might harm others so much that uh, I might be at loss. I just gave you the example of the team member. Means I shouted at my team member and my team member left the job. But then I don't have any team member and I'm supposed to perform. So I need to express even my anger appropriately. And for that, I need to regulate my anger emotion, the emotion of anger properly. When we talk about regulating the thoughts, because as I said, there are thoughts behind our emotions. The thoughts give rise to uh, the emotions, and therefore we need to monitor our thoughts. Dr. Albert Ellis, he's the founder of Rational Emotive Behavior Therapy. Uh, Initially, psychotherapy was quite different. Of course, I'm not going to go in that discourse, but uh, Albert Ellis was the founder of Rational Emotive Behavior Therapy, and Rational Emotive Behavior Therapy was the first therapy to demonstrate that when we regulate our thoughts, we can regulate our emotions, and this helps us to uh, have better mental health or better control on our life. And therefore, Albert Ellis is considered as pioneer in this rational emotive behavior therapy. No, now what he says, too many people are unaware that it is not outer events or circumstances that will create happiness. Rather, it is our perception of events and ourselves that will create or uncreate positive emotions. In short, what he says, our perception, our perception will create certain emotions. As I said, the same incident or the same situation in our clinic or in our life will create different emotions in different persons. For example, if I see a dog, I might feel to go and love the dog. Another person might be indifferent with the dog. And the third person will run away when the person will see the dog. So the dog is same, but the reaction is different. So that is how what he says. Our interpretation of the incident matter, or the particular thing matter. Also, what he says, there are three musts that hold us back. I must do well. you must treat me well, and the world must be easy. This is like this is the principle of rational emotive behavior therapy, where they say that we have three demands in our life. I must do well, or others must treat me well, or the world must be easy. So if we can deal with these situations, definitely we will be better in a position to control our situation or control our reactions to it, not situation, but we will be able to control the reactions to that situation. I'll give you an example. Here is a case, not case as such, but the day-to-day example, which we always see in our centers. ART center is full of clients. There is a deadline to complete the regular data entry, and plus an emergency meeting is planned. In addition to that, the counselor receives a mail stating, though I have here mentioned counselor, it can be any person here, the medical officer, counselor, or any other staff member of the team. Counselor receives a mail stating that some data of last 2 years is required today itself. So obviously, in our day-to-day situation, we experience multiple tasks come at the same time. So now, obviously, what will be the person's self-talk? How am I going to do this? This is just impossible. Why these people don't understand? Am I just sitting like this to do things, to do anything, anytime? My job is pathetic. I'm very unfortunate. Now, if this is a self-dialogue and if this is a thought, what will be the emotions? Obviously, anxiety, feelings. Now, what are the thoughts behind this self-talk? The thought is, I just cannot manage so many things. If I fail to do this, the consequences will be too bad. My boss will shout at me. This will be considered as my failure. I just don't know what to do. People must understand my situation. They don't have the right to ask anything anytime. They're heartless. So all these are the thoughts or self-talk. Now, what will be the consequences? Obviously, as we said, the counselor is emotionally upset. She cannot concentrate on work. There will be errors in the work, and all the tasks will be delayed. So here, what can be done? Recognize the emotion. See, emotion should be in our control. Means emotion should not drive us. We should drive the emotions. So this skill we need to learn. When we learn the stress management skill, we need to learn this skill. For example, I'll give you an example of a car. If we are a driver, we should be able to drive our car. Otherwise, what will happen if we are not driving our own car? Someone else will come to help us, and that person will drive our car. And that person might not take us to the desired direction. So it is important that we drive our car and go to the proper destination where we want to go. So in this way, we should have control on our emotions. Emotions should not control us. And therefore, you recognize emotion. You recognize your pattern of emotions. Pause, think, and do not react immediately. Choose appropriate response. For example, so many tasks are lined up already. One mail comes that so and so is required and so or so meeting is planned. So yes, I'm very anxious, but what should I do now? So just recognize that anxiety response. Tell yourself that calm down and think, what should I do now? Assess assess whether these thoughts are useful, logical, or based on evidence. Now we will go to this previous slide where we have mentioned the counselor's thought. See, for example, are these thoughts useful? I cannot manage so many things. If I fail to do this, the consequences will be too bad. So obviously these thoughts will not be helpful. These thoughts will not help the counselor to perform better. So on the dimension of usefulness, you should change these thoughts. Then what is another dimension? is these thoughts logical? I just cannot manage so many things. So if you see your own work history, you will be work history or life history, you will be able to identify that a lot of times you have done multitasking and you have managed many challenging tasks. So this statement or the thought that I cannot manage so many things is not evidence-based, or it is not logical. And also, my boss will shout at me and this will be considered as my failure. How the boss will shout? You can't do anything. Usually such words are used. So is it really equal to failure? No. The boss also was in that state of mind and therefore she reacted like that. And therefore it is not logical to consider that if my boss is shouting at me, it is my failure. So this thinking pattern, if we see these three dimensions, usefulness, logical, and evidence-based, these thoughts are not, these thoughts are not assessed by these, I'm so sorry, I'm making some confusing statements. So if we apply these three criteria to our thoughts, the thoughts will not fulfill these criteria. These thoughts are not useful, they are not logical, and they are not based on evidence. Now, thought modification will lead to healthy emotions, which will help in performing better. And flexible attitude will help rather than rigid attitude. Now, the thoughts can be like this. It is difficult to manage so much of work in the given time. Okay, so let me think what can be done. There is no choice. I will have to do it. If this is not done, my boss will be unhappy, but I'll explain him my situation. If he's still unhappy, I'll handle it. My worth does not depend on any one person's appreciation. I wish people understand my situation, but it is not the compulsion on them to understand my situation. If they don't, I'll bear it. Here, what is happening? The counselor is recognizing a difficult situation, but at the same time, the counselor is showing the readiness to handle the situation, and the counselor is confident that she will be able to manage with it. She will be able to handle that workload or the stress. So the things are not beyond control. And therefore, these thoughts will help the counselor to avoid emotional turmoil and concentrate on the work. Other skills this particular counselor needs to develop is, she should be organized, she should learn to manage her time, and she should learn to communicate appropriately. So all these things also definitely help in our day-to-day work. So till this slide, we talked about the changes in thought. Now we can see the usual errors which are observed in our thoughts. And these thinking errors create a lot of stress. These errors means incorrect understanding of the situation. For example, all or nothing thinking. Sometimes it is called black and white thinking. Means, for example, if I'm not perfect, this means I have failed. I know one example. There was one girl, she was expecting some 98, 99% marks in her examination, but she got some 90%. So she was considering that this is not her success. It's not good. My performance is so bad. I lost 10%. So this means if I get 98% or 100%, then I'm good. Otherwise, if I don't get, I'm bad. So this is all or none. Then mental filter. We pay attention only to certain types of evidence. For example, noticing our failures, but not seeing our success. This many a times we do. All of us, we make such errors in our thinking, but if we are doing these errors too frequently or in most of the situation, definitely we are going to feel quite depressed. Now, jumping to conclusions. We don't have enough evidence and we just jump to conclusion. For example, if someone shouted at me, I say, yeah, this person is very angry. This person can't control his anger. So I'm just jumped to the conclusion on the basis of one or two incidents. Then emotional reasoning, assuming that because we feel a certain way, what we think must be true. I feel embarrassed, and so I must be an idiot. I'm feeling guilty, so this means I must have made some mistake. Now, assigning labels to ourselves or to other people. I'm a loser. This person is stupid. I'm useless. They are idiot. So what happens when we label someone? We stop the possibility of improvement. For example, if you are always telling yourself, I'm a loser, definitely you are not going to perform well in anything because your philosophy is I'm a loser. And again, then you will not perform, again you will lose. So this will create evidence for you that you are a loser, which on the contrary is not. Now, overgeneralizing, seeing a pattern based upon a single event or being overly broad in the conclusions we draw. So overgeneralizing. For example, I remember there were some guests who had come to Mumbai in the rainy season, and they were traveling in Mumbai by train. In that particular week, it happened that the trains were running late due to rains or any other issues. So these people started telling us or sharing with us that Mumbai trains are always late. Mumbai trains are very inefficient. So what is this? This is overgeneralizing. On the basis of some experience, you are drawing some broad conclusions. Now disqualifying the positive, discounting the good things that have happened or that you have done for some reason or other, and you don't consider those things. You are focusing only on your negative things. And these type of errors quite frequently happen in depression. Otherwise also it happens, but this is most common in that disorder. Blowing things out of proportion, catastrophizing, or inappropriately shrinking something to make it, blowing things out of proportion, that is catastrophizing, or inappropriately shrinking something to make it seem less important. Means certain things we highlight and certain things we pay very minimum attention to that, or we say that it is not that important. Using critical word like should, must, I must get it, you should do it, you will have to do it. This means if we apply shoulds and when we apply these shoulds and must, it leads to a lot of frustration, because desire is a better word. For example, I wish it should rain today, or I wish it could have rained today. So this means my desire is that today the season is hot and it should be raining outside. But I cannot say that it must rain today, because I don't have any control on the external situation. Then another error is personalization. That is my fault. Blaming yourself or taking responsibility for something that was not completely your fault. Conversely, blaming other people for something that was your fault. So it is both ways. You are blaming yourself or taking responsibilities for something that was not your fault. And at the same time, you are also blaming on others for your fault. And see, in our surrounding, in our family, in our society, in our offices, we always see that these errors are happening. We also make these errors, and our other near and dear ones also are making these errors. So if we avoid these errors, we are conscious about it, we will be definitely able to reduce the stress to a certain extent. And also here, it reminds me, somewhere I had read, the language of our thoughts also matter a lot. For example, if I say it's too horrible, it is just impossible, it can't be done. So if we are thinking in these negative lines, definitely we are going to feel helpless. But if we say in these words, it seems challenging, instead of saying impossible, we can say it is difficult. So obviously, these words matter. When we say difficult, this means uh, uh, I will take some time to achieve it, but I'll be able to achieve it. But when I say impossible, I stop my efforts to achieve those things. So we should even mind our language, our own language. Now, this is another phenomenon, learned helplessness versus learned optimism. In many situations, we see these phenomenon are happening in community, in our society, or in our personal life. Learned helplessness is a state that occurs after a person has experienced a stressful situation repeatedly. They come to believe that they are unable to control or change the situation, so they don't try, even when opportunities for change become available. Here I remember one experiment. This is Martin Seligman's experiment he had done on dogs. So this experiment is quite complicated. I'm not going to talk about it, but on the basis of that, there was another experiment which was done by someone else. Uh, it is actually not experiment, but some data evidence. For example, there were some African American boys in the school, and always the school teachers used to complain that African American children perform very poorly in academics, especially in mathematics. Now, this researcher found that African American boys, since their childhood or since their generations, they have been told, or somehow this understanding has been given, that they cannot do well in academics. The children have carried the same understanding that I can't do well, and sort of learned helplessness is there. So even if they have the ability, they used to perform poorly in the academics. So when intervention was done to remove this learned helplessness, the children started performing better. And these researchers have done like a detailed study of these children, and those interventions they have documented. Learned optimism. Learned optimism is the process of recognizing and challenging pessimistic thoughts in order to develop more positive behavior. Like, as I said, the helplessness feeling is carried for a longer time, or we learn that feeling of helplessness. At the same time, we can unlearn and we can learn the optimism, the process of recognizing and challenging pessimistic thoughts in order to develop more positive behaviors. So if we attack our negative thoughts, and if we change into not positive, I can say, but if we change it into optimistic thoughts, definitely the behavior can be constructive behavior. This concept aims to help people find new ways to manage tough situations and improve their well-being. So in our health situation as well, in this pandemic time, we experienced a lot of learned helplessness. Now it's time that we should learn the optimism. And such programs can be done in our own settings, where we can focus on certain emotions which are experienced commonly by all, and we can have certain messages or certain discussions to change those things. Now, dealing with stigma and discrimination, because in this epidemic situation, the healthcare workers experienced a lot of stigma and discrimination. So what can be done? Now, as we said, the people, external situation, we hardly have any control on them. But definitely, it's certain things we can definitely monitor, certain things definitely we can control. So we should first understand the stigma is due to the fear of infection. So address this fear by giving appropriate information and data. Like, for example, in this COVID pandemic, some families, the entire family got infected due to this coronavirus. In that families, in that particular family, no one was working in any hospital. No one was working in healthcare setting. Still, they got the infection. But where the healthcare workers are there, their family members might not have got the infection. So basically, fear is not the solution, but taking precaution, taking care is the solution. So effectively, we should address this fear and give this proper information. We should also give this data. When we give data, people start believing or start showing trust on the things. Also address the misconceptions. Share information on social media or share the information personally. Also, in such situation, sharing and caring with your colleagues and other loved ones also matters. We should take support from others. Those who are ready to support, we should take support from them. Also, be assertive. Make joint efforts to deal with stigma and involve local administration and policy maker wherever possible. Now, mindfulness exercise. Actually, this exercise we can take later. We can first finish some of our informative slides and then we can go towards this mindfulness exercise. And there I'll explain you what is mindfulness and how it helps us to deal with the stress. Now, mental health issues. Mental health issues are observed. They are very common in our community, in our society. And in this particular COVID-19 pandemic, most predominant issues observed are anxiety disorder, a major depressive disorder, substance use disorder, and post-traumatic stress disorder, as well as grief reactions. So these are common mental health disorders we are observing right now. And these are very common disorders, like anxiety disorders. It includes generalized anxiety disorder. In generalized anxiety disorder, the anxiety is, there might not be any particular reason for the anxiety, but still the person is experiencing the anxiety, which is quite unmanageable. Also, there are panic attacks, panic disorder, like there are attacks of anxiety. The like person can't breathe, there is dry mouth, the person may faint, and so on. There is obsessive compulsive disorder, which I think most of us know about it, that we have certain obsession. Obsession is a particular thought is coming again and again in my mind. So that is obsession. And compulsion is behavior. I'm doing a particular act again and again. While going out, I'm checking again and again whether the door is locked. While sleeping, I'm checking whether I have turned off the gas or no. So that is the compulsive behavior. So this obsessive compulsive disorder also is happening frequently, and also many types of phobias are increasing. Post-traumatic stress disorder, because yes, many people underwent traumatic situation, and so this disorder also is prevalent. Mood disorder, especially major depression, personality disorders, and psychotic disorder, where you have some different experiences. It includes even the schizophrenia. So these are the common mental health issues. And if we observe these issues, we need to refer the person to the mental health professional. Now, another point which we need to cover is grief. Grief is a natural response to loss. We have emotional suffering when something or someone you love is taken away. It may be a thing, or it may be a person we love, or it may be our pet or anything. You may experience all kinds of difficult and unexpected emotions, from shock or anger to disbelief, grief, guilt, and profound sadness when you are grieving. It can disrupt your physical health, which makes you difficult to sleep, eat, or even think straight. These are normal reactions to loss. And the more significant the loss, the more intense your grief will be. Now, how to take care of grief? Basically, acknowledge the pain. Accept that grief can trigger many different and unexpected emotions. And don't make unnecessary demands from yourself. Like, for example, I'll just give you an example. In my office, there is one person whose family member expired recently. She is grieving, she's very sad, but she's feeling guilty that she cannot perform, she cannot concentrate on the work. she's not delivering what she's expected to do. So sometimes she's like grieving, and at the same time she's feeling guilty because she's not fulfilling the demands. So basically at such times the person need to understand that all these things are natural, and one need to give adequate time to go through the grieving process. So one should seek out the face-to-face support from people who care about you. Support yourself emotionally by taking care of yourself physically. Have good nutrition, sleep, or whatever you want to do. Also, this might sound weird to some people, but it really helps. Evidence has shown this, that write a story about the person who have lost, or write a letter to that person. Try to connect to that person through the things or through other memories like photographs or the objects the persons have used. So try to be with that person and make some connections, and this really helps a lot. Express your feelings to the loved ones. Share your emotions. Now, when we are undergoing of so much of stress, exactly when we should seek professional help, because definitely there are many things which we can do of our own, but there are definitely certain things which are beyond our limit, and we need to seek professional help. So what are the indicators for that? When we should go to the professional? If the symptoms are not getting cured, even if you are trying various strategies discussed earlier, so consult the psychiatrist or a psychologist. If the symptoms are causing significant distress in your day-to-day functioning for a long time, maybe like certain things happened or there are certain issues, and you feel that yes, it is manageable, but even if 8 months, 1 year has passed, and still I'm at the same stage, on the contrary, my distress is increasing, then definitely you should seek the professional help. Your biological functions like sleep, appetite, digestion, etc. are getting affected for a significant period of time. Yes, when we are under stress, all these things get affected. But if it is getting affected for a longer time and it is taking toll on your health, then definitely you should consult a professional. Also, if your relationships are getting affected, you are frequently falling sick due to stress, like even the common cold is experienced due to stress, and all we know, like diabetes and other psychosomatic illnesses also are the cause of stress. If you have odd experiences like voices in your ears, then you should consult a professional. And also, if a person has suicidal thoughts, then definitely one should not wait, one should immediately consult a professional, especially the psychiatrist. Also, be in touch with your own psychological processes. Recognize various symptoms of psychological disturbance. Psychological disturbance may reflect in the form of physical illness too. For example, common cold, stomach upset, diabetes. Deal with the misconception that health. For example, mental health issues are a sign of weakness. I'm so strong. I do not need any support. My disturbance is not so extreme. Why should I seek professional help? So basically, these things prevent people to going to a mental health professional. One thing is that they feel that mental health issue is a sign of weakness, and therefore they want to avoid that. Another thing is that stigma and discrimination. The third thing is that there is one misconception that if there is physical illness, yes, I should consult a doctor. Even if my stomach is upset or if I have acidity, I should consult a doctor. But if I have anxiety, anxiety should be managed of my own. I should not consult any professional for my anxiety. So these are certain misconceptions, and we should address those misconceptions. Obviously, now for each and every anxiety situation, you will not consult. But definitely, if anxiety is your pattern and your performance is getting affected due to the anxiety, definitely you should consult. Now, this is a questionnaire, patient LPHQ questionnaire. Usually this is used to assess the severity of depression. So I'm just reading these like statements in this questionnaire or this tool. But my advice is, this is just for our understanding or information. Request you not to administer this questionnaire to any person, because it should be used under supervision or it should be used by the professional. And alone this tool will not give any final diagnosis. There should be other assessment criteria. There are other assessment criteria applied by the professional, and on the basis of that, the professional will take a decision of labeling that person for having depression or no. So there are many like dimensions to a diagnosis. So this is just for our information. We can just concentrate on the symptoms given here of depression. And why this is useful for you? Because you must be dealing with the many patients in your day-to-day life. So if you observe these symptoms in your patients, you should make referral to the psychiatry department. So I'll just read it rapidly. A little interest or pleasure in doing things, feeling down, depressed or hopeless, trouble in falling asleep or staying asleep, or sleeping too much, feeling tired or having little energy, poor appetite or overeating, feeling bad about yourself, or trouble in concentrating things, moving or speaking so slowly that other people could have noticed, or the opposite, being so fidgety or restless that you have been moving around a lot more than usual, thoughts that you would be better off dead or hurting yourself in some way. So these are the symptoms of depression. And if you observe these symptoms in any patient or in your family or in your surrounding, you should refer that person to a psychiatrist. Now, this is a GAD-7. This scale is there to assess the generalized anxiety disorder. Again, the same advice. This is just for your information and do not administer it on anyone. Feeling nervous, anxious, or on edge, not being able to stop or control worrying, or worrying too much about different things, trouble in relaxing, being so restless that it is hard to sit still, being easily annoyed or irritable, or being afraid as if something awful might happen. So, and the scoring also is given here. So if you have definitely severe anxiety or moderate anxiety, the professional intervention is required. Now, professional help, to whom we should approach. Definitely, if there are psychiatric disorders, then definitely first you should consult a psychiatrist. And also in mild psychological disorders, the help of a psychologist is extremely important, because psychotherapy is the answer for many minor disorders along with certain medicines. Then if you have just psychological distress, there is no disorder as such, but distress, consult a psychologist. But here I would like to give you one information, like when you want to consult a psychologist, you must see the experience and the training background of that psychologist. Because in India, at many places, the psychology training is not standardized. And therefore, some psychologists are not equipped to deal properly with the patient population. And whereas some psychologists are really thorough in their work. So you should properly see the psychologist's experience and background, and then consult the psychologist. And for major psychiatric disorders, obviously you will have to consult a psychiatrist. Also, such simple things which have started coming nowadays, that coaching in emotional intelligence and mindfulness, these things also help us in our overall emotional or mental well-being. So you can also go through these courses, or see the information on various websites, or there are various films available on that. So in this way, you can see what is your level, whether you assess yourself, whether you really need to seek professional help, or you need to just work yourself on your issues. Now, where the mental health professionals are available. So all tertiary hospitals, district medical college hospitals, district hospitals and medical college hospitals, everywhere we have psychiatry departments. Then obviously there are private medical practitioners and the directories are available online. And also there are helplines are available. In our Tata Institute of Social Sciences, we have our own helpline called I Call Helpline. The number I have mentioned here, 2552 and 4 times 1. There is another helpline, which is National Mental Health Helpline. Its name is Kiran and the number is mentioned here. Also, in addition to that, there are various helplines offered by NGOs. So, like if there is no psychologist or psychiatrist available in vicinity, you can definitely call these helplines because they also are playing very important role in managing mental distress. Now, how to help the HIV positive clients. Discuss the importance of mental well-being and mental health issues. And remember that there is a stigma to mental health. So addressing the stigma is very important. Address the mental health issues the clients are facing. Discuss various points mentioned in the slides, which we have discussed so far. And also make referrals to psychiatry department if necessary. Or if that is not possible, provide helpline numbers and other service providers contact details to that person. Now, many professionals, many health workers, they say to me that we don't have time, so much time to do so much of assessment. So really speaking, I know, means basically in ideal situation, we should do the thorough assessment. But if that is not possible, maybe some small dialogues or less time consuming dialogues also can help. Here I can show you one example. Mental status examination. This is a tool which is used in psychiatric practice. It is a structured way of observing and describing a patient's psychological functioning. Obviously, the psychiatrist, they take the overall history of the client, they observe the symptoms and so many other things. And along with that, these areas also are observed and assessed by them. That is general appearance. For example, if a person is depressed or anxious, he might not be very particular about his appearance or what is the behavior. The behavior, if the behavior is normal, if the behavior is odd, or the behavior showing some anxiety. For example, anxious person, they might do something with their nails, they might do something with their hands, they might not be able to sit properly. Or if the child is ADHD, attention deficit disorder, ADHD, attention deficit hyperactivity disorder, the child will not sit at one place. So just observe the behavior, thought process and content. How is the thought process? Then affect, whether the person's affect is appropriate. Appropriate means, for example, if something negative has happened, but the person is looking happy, this means something is not correct or something needs to be done with that person. So how is the affect? Then impulse control, insight, whether the person has insight, why my illness is there, how like I got infected. So whether this insight is there. Then cognitive functioning. For example, what is today's date? What is the time? Where are you? Just these simple things. Then intelligence. How is the overall intelligence? When you interact with a person, you realize whether the person has a normal intelligence or the intelligence is below normal. Then reality testing, whether the person has suicidal or homicidal ideation, and the judgment. So all these are very important aspects. And obviously, like though you might not be able to do all these things, quickly you can obviously see the general appearance, the behavior, the thought process, because the clients are sharing what happened to them and how were they if they are coming for the second or third session, they are sharing what was going on for so many days in their life. So while interacting with them, you will be able to assess these things. And on the basis of that, if you feel something odd is there, you can explore something more. And also another point is you need to connect the person on emotional level. If at all possible, you connect the person on emotional level. And like if you do that, the person himself or herself will start explaining many details or many things with you. For example, if a person or the client has walked in and you say, I'm glad to see you, you are looking good, so what happened, how are you? If you just say these two sentences, the person will start narrating so many things. So maybe you need to connect with the person. My point is connect with the person, and they themselves will come and tell you what are their problems. So you yourself need not do so much of assessment. You just need to observe. And if you feel something is odd, you can definitely refer. So this is a MSc form in which all these details are there. Obviously, you need not, because this is meant for but you can just have it for your own reference. Yeah, thank you. And before winding up, I would like to do this mindfulness activity. Uh, Shweta, do we have time for that?
We can have it for 2 minutes, ma'am.
Okay, yeah. Yeah. Sorry, I think I have exceeded time. Yeah. I'll stop screen sharing. Now, I would like to tell you about mindful. Learn to focus our attention on certain things. For example, in our day-to-day functioning, we see that so many notifications, there are so many messages, emails, and so many things are going on, and we cannot focus on anything. And otherwise also we can see that for example, while doing our work, we can see that we are doing the work, but either we are in the past or in future. But if we focus our attention on the present, this activity will just take 2 minutes. Please close your eyes. Yeah. Now bring your attention to the middle part of the room. Now focus your attention to the four walls of the room one by one. Now focus your attention to the reading distance. You must have realized by this time that you can decide where you want to focus your attention. Now let us focus our attention on our breathing. Concentrate on your breathing. Breathing in and breathing out. Feel the sensation in your nostrils. Feel the sensation in your chest and stomach. Again, concentrate on the experience or sensation in nostrils, then chest, and then stomach. You must be experiencing that your mind is wandering. So gently bring it back and feel the sensation of breathing. So whenever the mind is wandering, gently bring back the attention to your breathing. Feel the tranquility you are experiencing. Now slowly open your eyes. I'm sure you must have experienced that the mind wanders or the attention is shifted to so many places. But we have the ability to bring back our attention to the desired place or desired activity. And this training, if we really do this again and again, and if we practice it, it really helps us in reducing our stress. So this mindfulness-based training, mindfulness-based stress reduction, this strategy is used in developed countries actually at many places to manage with the stress, and especially in medical fraternity, this is being very particularly. So I'm sure all these strategies might have been useful for you. So I would like to stop my session here, and maybe like, I don't know whether we have time for question and answer. So if you have any question, maybe you can type the question and I can answer by mail or right now if you have time. Yes.
Yeah. Thank you, ma'am. Thank you to all the participants for patient listening. In case you have any questions, please feel free to write back to us. You can just reply to the same email ID from where you have received the invite. I think we can end the session now. Thank you once again, ma'am.
Okay, thank you. Thanks a lot. Thanks a lot for patient listening. Thank you. Bye. Bye.